At Baylor, we've started our Pancreatic Cancer Research and Treatment Center really to try to cure pancreas cancer. Pancreas cancer has historically been a very difficult disease to treat, and we have brought together experts in all of the fields involved in the treatment, the surgeons, the medical oncologists, the radiation oncologists, the radiologists, the pathologists, the gastroenterologists, in order to try to treat this disease. Unique thing about our center is the dedication to research, developing not the treatments of today, but the treatments of tomorrow.
This center, we started the project several years ago. The whole idea being that we needed a comprehensive approach to the management of patients with pancreatic cancer, both at the early stage and at a later stage of their disease. Pancreas cancer is a very complex disease. It requires a multidisciplinary approach. Fortunately, at Baylor, we have that team of experts that can provide that multidisciplinary approach. What we did was we formalized the team and brought in the group that was interested, not just in the treatment of patients with pancreas cancer, but in the research of patients with pancreas cancer, because research is the only way to answer questions and to try to improve the outcome of our patients with pancreas cancer.
We study mostly cancer prevention, early detection of cancer, and finding ways to treat cancers. Most cancers are diagnosed very late, and when we diagnose cancers late, patients have limited options in terms of their outcomes. So we are focused heavily on early detection of cancers.
Pancreas cancer is difficult to treat because the organ itself, the pancreas, is in an area of your body that's difficult to reach. As such, by the time the patient starts having symptoms, those tumors have already, most of the time, have metastasized. And we are in the process of trying to develop a good screening tool for these patients.
So the main modifiable risk factors for pancreas cancer would be smoking and obesity. Obviously, stopping smoking decreases the risk, and a good diet and exercise program in order to help prevent obesity and reduce obesity has the potential for decreasing patients' risks. There are a number of genetic mutations that we know of that increase people's risk for pancreas cancer. And by knowing that, we can, number one, know what other cancers these patients are at risk for developing, but also can screen their families in order to be able to tell if they're at increased risk for pancreas cancer.
Because of the complexity of pancreas cancer and the requirement for a multidisciplinary approach, we have a specific pancreas cancer conference that's on every 2 weeks, where all these experts from the multidisciplinary team come together to discuss the cases. In this conference, we discuss the cases in a very detailed fashion, and we go over some of the clinical trials that we have available for our patients and where they can be enrolled, which one of the studies they can be enrolled on.
With the nurse navigation department, once we receive a referral, we start connecting with that patient by reaching out to them. We call them, we let them know what the next steps will be. We ask questions and assess the patient to determine where they're at in their current treatment plan. We help facilitate their appointment and let them know next steps. We would provide them with information about our campus as well as directions, and also the resources that are available to them should they need those.
So our ultimate goal is to cure everybody's pancreas cancer, but that's the end game, and that's going to be a stepwise fashion. So one of the other big things that we're trying to do is take all of these patients who come in with inoperable tumors and convert them to operable. And again, that's where a neoadjuvant approach, or treating people with chemotherapy and or radiation before surgery, is helping us. And we have been converting a number of patients from inoperable to operable, and taking them from what looks like an incurable disease to removing it and giving them potentially a cure.
We have an integrative medicine clinic, which we offer to our patients, and it brings a new dimension into the management of our patients, not just from the nutritional standpoint, but other alternative medicines that can be incorporated into the management of our patients for their welfare and well-being. Baylor is a unique system because it brings together both basic scientists and clinical scientists. And I have been able to take advantage of the Baylor system to interact with the basic scientists and take their ideas on to the clinic. Two examples in pancreas cancer. One is the development of the dendritic cell vaccine for patients with metastatic pancreas cancer, and a second study looking at a inhibition of a specific cytokine to try to improve the activity of our chemotherapeutic agents.
We've got clinical trials available for pretty much everybody who has pancreas cancer. Immune therapy has been in the news a lot lately, both looking at medications to alter the immune system to try to help it fight the cancer, as well as looking at vaccines in order to, again, help the immune system fight cancer, both of which we have studies at Baylor trying to use in order to treat the cancers. For colon cancer, we have colonoscopies. For breast cancer, we have mammograms. For pancreas cancer, we don't have that. And what we really need is a mammogram or a pancreaticogram to detect pancreas cancer earlier. And that's one of the things that we're working on, is developing early markers for detecting pancreas cancer in its earlier stages when it's more treatable and more curable.
We've learned that most cancers, they release their tissue or DNA into bloodstream, into saliva, into fecal specimens. So having a non-invasive tool, a liquid biopsy approach, where we can monitor a few number of tumor cells circulating in your bloodstream and be able to have the same level of sensitivity and specificity to identify that cancer, is absolutely revolutionary.